All right, let's dive right in. Imagine this. A 45-year-old man walks into my clinic. He's got a cough, fever, shortness of breath, chest pain, all for 5 days. His cough's productive yellowish sputum. When I examine him, he's febrile, breathing fast, and I hear reduced air entry with crackles over his right lower lung. Why is the chest X-ray my next move? Because it's the key investigation for pneumonia. Not only does it confirm the diagnosis, it pinpoints exactly where and how much of the lung is affected. Plus, it helps spot complications like pleural effusion or a lurking lung abscess. But before I jump into abnormalities, let's quickly recall what a normal chest X-ray looks like. The lungs appear black because they're full of air, vascular markings are clear, and, crucially, there are no white patches. Now, on to the main event. What do I see in pneumonia? First up, lobar pneumonia. Here, the classic finding is lobar consolidation, a solid white opacity filling a whole lobe. Look for the air bronchogram sign, air-filled bronchi standing out because the surrounding alveoli are jammed with pus or fluid. For example, right lower lobe pneumonia lights up the lower right side of the X-ray, but the fissure lines stay clear. How about bronchopneumonia? This is more scattered. The X-ray shows patchy, fuzzy white spots spread across both lungs, mostly around the bronchi, without clear-cut boundaries. Next, interstitial pneumonia. Instead of solid white patches, you'll see a hazy, reticular, or ground glass look. Think of it as the lungs losing their usual sharpness. This one's common with viral or atypical bugs. Don't forget the associated findings. Pleural effusion. That's when you see the costophrenic angle blunted, or a classic white meniscus. If there's a lung abscess, you'll spot a cavity with an air fluid level. And if things get really bad, severe pneumonia might show up as extensive consolidation on both sides. But here's the catch. Never diagnose pneumonia on X-ray alone. Always tie what you see to the patient's story. Fever, cough, high white blood cell count, and how they respond to treatment. After treatment, I'll order a follow-up X-ray in 4 to 6 weeks. That's to make sure the pneumonia's gone, and there's nothing more serious lurking, like malignancy or TB. So to sum up, pneumonia is a clinical diagnosis backed by chest X-ray. Watch for consolidation, air bronchograms, patchy infiltrates, and pleural effusion. But above all, always link what you see on the X-ray to the patient in front of you. That's the real secret to mastering pneumonia.